This video is about insulin resistance and how to overcome it. So lots of people are told that they have insulin resistance when they are told that they have diabetes or pre-diabetes. But they don't typically understand what insulin resistance is. So in this video I'm going to show you how it works with some really nice, simple, well, mostly simple images. So if you just want to go read for yourself, you can just Google or whatever you want to use, whatever search engine you use, just for insulin resistance, and multiple accurate, proper definitions will appear. And you get a picture, and it shows you typically, who it is they're referring to. Unhealthy, middle age or older. Now, I'm 60, so if you think about 0 to 30, that's young. Up to 60s, middle age, and then beyond that, well, now you're old. So I am 60, so I'm in this final third of life. So I look at her and I see a 50 to 65-year-old who is a non-exercising, obese woman who has diabetes. Why does she have diabetes? Because her skeletal muscles are resistant to the hormone insulin, causing blood glucose levels to rise. Now, it's not just muscle that respond to insulin, so do fat cells and liver cells, but the biggest and most important utilizer of glucose and maintainer of normal glucose levels are healthy skeletal muscles. So I'm going to show you what happens when the flame goes on, because it's inflammation that causes muscles to become insensitive to insulin. So it is the pro-inflammatory cytokines that I've discussed in other videos, like the coronavirus videos. It's the pro-inflammatory cytokines that are produced by immune cells that cause insulin resistance, and it's actually from obese fat cells, and I'll show you those pictures too. Okay, so first of all, let's figure out how pervasive it is. So in the United States, you have 320 million people. Here you can see more than 34 million have diabetes, more than 88 million have pre-diabetes, and so you're talking about 122 million people with elevated blood glucose and therefore insulin resistance. I mean, this is staggering, and it's only getting worse. It's because obesity gets worse. So you have to think about this. The lockdowns that created for a lot of people where they actually added COVID, 19 pounds on top of them, they've actually have worsened their diabetes, which means that they've increased their risk of having a horrific flu or coronavirus COVID outcome if they get infected this coming winter. So it's only going to get worse, unfortunately. Easy to fix, but we just have to appreciate the absolute pervasiveness of this problem and the fact that now we have a massive diabetes industry that must be sustained by ongoing diabetes disease. So it's a bit of a mess what we have currently going on. So let's look at an artery. So this is called atherosclerosis. So if you get atherosclerosis in your heart, you have a heart attack. In your brain, you'll have an aneurysm. If you have atherosclerosis, which means really a biological rotting of arteries, if you get them in your lower extremities, you're going to end up with what's called peripheral artery disease. You start walking, and because the blood vessel lumen where blood flows has become so narrowed, when you walk, now you get leg pain. And then, of course, this also is a driver of male erectile dysfunction. So atherosclerosis is the name for what's occurring here in the blood vessel, in the artery, but it has different disease names depending upon where it is. Again, stroke, heart attack, peripheral artery disease, impotence as examples. So the key for this video is insulin resistance, so hyperglycemia. Now, in this book that was released on Amazon in January of 2020, I discuss coronary artery disease, atherosclerosis, because it is biochemically really no different than osteoarthritis, muscle atrophy and degeneration that occurs with insulin resistance, osteoporosis, tendinosis. All those conditions are very similar to atherosclerosis, which means that basically osteoarthritis is atherosclerosis of joints. Well, how do you know? Well, the same inflammatory chemicals drive it. Here's a picture of osteoarthritis. You can see here. I'm just focusing on the hyperglycemia due to time. It's all described herein. So Rotting joint cartilage. Why do I call it rotting? Because it's a biological rot. It's a chronic inflammation where the joints simply do not heal, and you end up with this kind of formation due to lack of healing and chronic inflammation. Here is a rotting tendon. You call it tendinosis is the word. Chronic tendinosis also caused, you can see here, hyperglycemia. Now, of course, if you're young and healthy and you do some violent activity, you can damage your tendon or damage your joints, but the average person who develops osteoarthritis, tendinosis, old and hyperglycemic to varying degrees. In one article that I read a few years ago when they were talking about tendinopathy in diabetic patients, they said that's pretty much, if you have type 2 diabetes, you have a rotting tendon somewhere. Yeah, if you have type 2 diabetes, you're going to have rotting arteries somewhere. So it's the hyperglycemia that drives all of this. Here is disc degeneration. So these pro-inflammatory factors right here, which I'm not going to describe, you can read the book, are turned on by hyperglycemia, and they facilitate disc herniation. So insulin resistance is just not about diabetes. Insulin resistance drives all chronic diseases, including cancer, and as well as Alzheimer's. Fatty liver is also, and therefore cirrhosis that comes from it, also hyperglycemia, in addition to vascular disease and all these muscle joint problems. Here is osteoporosis, which is biological rotting of bone. You can see nice, thick, healthy bone, and you have weakened, rotting bone. Here, look what we see here, hyperglycemia again. So this insulin resistance issue is enormous. What happens to your muscles as you gain body fat, exercise less, and become hyperglycemic? They literally transform into a rotting state of muscle. Here is an insulin-resistant, hyperglycemic, rotting muscle. We'll focus here just briefly. Look at this. You can see triglycerides. These are fat storage areas in skeletal. This is normal, deflamed, healthy muscle. A little bit of stored triglyceride for energy. Look what happens in your insulin-resistant, hyperglycemic muscle cell or muscle tissue. Massive infiltration of fat as part of it. So this is literally like atherosclerosis, right? Fatty infiltration of muscle. So insulin resistance causes all this. We got to go through how insulin signaling works, normally speaking, before we show resistance. So there's no point in describing, what these are other than to say they're just signaling proteins involved in insulin signaling. And I'll show you how they work. They have different names. I still don't know what AKT acronym means. This is called insulin receptor substrate. This is called phosphoinositol 3 kinase. Obviously AS160 and GLUT4. Now GLUT4 is a transporter of glucose. So in skeletal muscle, if you have glucose here, it cannot enter skeletal muscle just freely through the wall, the cell wall. This would be blood vessel. This is skeletal muscle. Glucose cannot just go right through. Glucose can only enter skeletal muscle if that GLUT4 transporter channel is moved from the muscle cell to the muscle cell membrane. And that is the purpose of insulin signaling. Here's how it works. Blood glucose levels rise. Here is insulin that came from the pancreas. Blood glucose levels rise. The pancreas releases insulin, and basically simultaneously, for our purposes here, insulin will bind to its receptor, and chromium will then enter into skeletal muscle, and it looks like this. So now you have two events that are going to activate this signaling sequence. So first, what happens is chromium, apochromodulin, becomes what's called chromodulin, and it binds to the receptor to initiate signaling. And the chromium that has entered skeletal muscle is going to activate PI3K to facilitate signaling of AKT, and here's what it looks like. Boom. Simple as that. So after activated, PI3K will stimulate AKT, which will then, AKT's job is to inhibit AS160. Now AS160 being inhibited, it allows GLUT4 to go to the membrane, and glucose now enters the skeletal muscle. That's normally what happens. Now the one thing that I didn't show you thus far explain is what this is right here. This is a receptor for pro-inflammatory cytokines. So if cytokines are in excess in circulation, they will activate the cytokine receptor on skeletal muscle and block this process from happening. And there it is. So now GLUT4 is stuck inside the muscle cell because the cytokines have activated their receptor, which then causes inhibition of signaling. So even though insulin can bind, the GLUT4 transporter stays inside the cell membrane because the signaling domino effect has been inhibited by pro-inflammatory cytokines, and that will cause blood glucose levels to rise, 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 and rise more. So where do these cytokines come from? Cytokines, in the average person, I mean, they're always outliers, but the average person, their cytokine levels rise basically as we gain body fat levels. So here is normal, healthy, lean body fat called adipose tissue. It consists of fat cells, and these other 4 cells that you see here, they are immune cells. Treg, M2, Th2, they're anti-inflammatory immune cells. When you overeat sugar, flour, refined oils, and gradually become obese, then we get an immune cell profile change in fat mass to the point where you end up with swarms of a certain type of pro-inflammatory macrophage to deal with the necrotic fat cells that are dying due to basically hypoxia and lack of space and an inability to go through normal cell recycling. So these immune cells that habitate or that occupy obese fat mass are the ones that release these pro-inflammatory cytokines. So you can see, she's saying, well, you know, I'm insulin resistant or I have diabetes. What it is, she is obese and pro-inflammatory. And as a consequence, her insulin signaling is inhibited, she has insulin resistance, and glucose levels rise. So what does she have to do? She has to lose her pro-inflammatory fat mass and needs to exercise, because I'm going to show you, in fact, skeletal muscle activity, exercise, stimulates glucose uptake. So it stimulates the insulin signaling process. So I'll show you how that works. So starting from the flame, here we are. So our patient, our person we saw in the previous image, obese, 50 to 65-year-old, and there are millions of them, right? 122 million people, whether they're that age or not, have excess cytokines, blocking insulin signaling, so that when sugar levels rise, insulin binds, but nothing happens because GLUT4 stays inside the muscle cell because of the because of the high levels of cytokines in circulation. And this correlates almost directly with a simple test you can do called high sensitivity C-reactive protein. So anyone with insulin resistance has elevated levels of C-reactive protein in circulation. Okay, so back to this, what we showed you before. I'm going to add to what I showed you before. So here we are again. So the obese individual, no matter what their age, loses body fat, starts to exercise, and all of a sudden cytokines are no longer there, blood glucose levels rise, insulin binds, chromium enters. Now chromium and insulin are going to activate the internal domain of the insulin receptor, and chromium is going to go activate PI3K and starts the signaling. Boom, there we go. Next step, we showed before, AKT is activated, and then AS160 is inhibited. That is what we like. That is what is normal and what is supposed to happen. So from here, off GLUT4 goes to the cell membrane. Now, there are other things involved with this. So I mentioned before about muscle contraction. Well, how does muscle contraction work? Well, here's how muscle contraction works. So here's muscle contraction. The muscle is contracting, right? Skeletal muscle. So contracting skeletal muscle activates a signaling molecule called AMPK. Look what AMPK does. It inhibits AS160. So you can see here how exercise is going to directly inhibit AS160 and push the GLUT4 transporter to the muscle cell membrane. So AMPK will directly do it, will block AS160, and AMPK will further activate the IRS1 complex along with the insulin receptor being activated to push AS160 to be inhibited. Pretty straightforward. So you can see here why being inflamed and not exercising is problematic, because we lose the ability for IRS1 to be activated by insulin, and if we're not contracting muscles, we lose that stimulation of the IRS1 complex. Okay, so what else do we need to know about this signaling system? Well, magnesium is important for these 3 steps here. What else is needed? Well, it turns out that a supplement that many people have heard of called lipoic acid activates AMPK. So you can see here I'm kind of building based upon the signaling, supplements that can be taken to support insulin signaling, chromium being one, lipoic acid being another, magnesium being a third. Now it turns out that these pro-inflammatory cytokines, their excess can be modulated or reduced if you have adequate vitamin D, have taken a bunch of anti-inflammatory spices, and have adequate omega-3 fatty acids. So lipoic acid can be used as a supplement, chromium can too, magnesium, these 3 as well. Now notice I'm not telling you how much you should take to treat all this, because this is not a treatment video. This is kind of showing mechanisms. So if you have this problem and you want to do this, you should consult with your treating physician, or find one who will work on you to get you free of your diabetes medications, and then can also guide you in these supplements. So here is another issue that I'm going to bring up that I want to show you regarding these supplements. So let's just say that all you did was stay the same obese, non-exerciser. And all you want to do is take these 6 supplements to try to normalize, well, lipoic acid would be here, right? Take these supplements, these 6 supplements, to try to normalize insulin signaling. Kind of doesn't work that great if you stay obese and don't exercise. You know, at least enough to get your muscles somewhat normal in terms of their physiology. So the key, of course, is exercising and getting rid of the excess fat mass to whatever degree it takes to normalize CRP, blood lipids, and all the glucose markers. So how do you do this? Well, pretty simple. Get your weight normal, as I mentioned. Get your glucose lipid levels normal. Get your vitamin D level normal. Consider some of these supplements also. Consult with your physician. The biggest simple thing to focus on is replacing refined food calories with vegetation. So here are your refined food calories that should be replaced with vegetation. Doesn't mean you can no longer have any of this. It just means you got to reduce it until you do what? Get your weight normal, get your glucose and lipids normal. So that tells you how you let your markers guide your dietary change. If you don't want to become, so look at my brother here. So he weighs 190 pounds here, and he weighed 340 here. Well, this was in 2018, I think this was 2018, this picture of him. This picture was 2018, but he has been like that since 2007. So he weighed 340 here, and now he weighs 190. Now, he could have probably stopped at 215 if he wanted to and maintain normal glucose levels as well as normal lipids. But he went down even lower. So what you can do is drive your weight loss down to the point, and your activity level to the point where you normalize 1 and 2. And then obviously supplementation or sunshine for vitamin D. And again, we talked about these potential supplements, as well as, and the key to getting your weight down is, of course, to replace these refined food calories with vegetation. So I showed you previously the images earlier in this video, and they all came from this book here, because these same calories that you see on the cover of this book and this book, they drive all chronic diseases when consumed in excess. So these 3 books are really great books to read through if you want to free yourself of insulin resistance and all the problems that follow along with it. These books can be picked up as individual copies from Amazon. And if you want volume discounts, you can go right to dflame.com, and you can look at all the information I have there as well. But here you can see where the volume discounts are available. And of course, on the top of the dflame.com page, you can go right to the YouTube channel where you are right now. So right there, right now, you can click subscribe if you want, and also click right through and follow Deflame Nutrition on Facebook.